You're listening to IHC's podcast.
Welcome back to IHC's podcast. My name is Marissa Hemstreet. I'm the communications coordinator for Indian Health Center, and I'm here today speaking with the lovely Dr. McCraven.
Thank you very much. Hi, everybody.
Awesome. And then would you like to share your name, pronouns, any title, tribal affiliations, or where you're from?
Sure, absolutely. So my name is Liz McCraven. I am a family medicine physician, and I am also the chief medical officer here at Indian Health Center. And formerly I was a medical director. And before that, I just was a doctor here, saw patients. My pronouns are she and her, and I don't have any tribal affiliation that I'm aware of, and the DNA sample does not point to any likelihood that I have any tribal affiliation. I didn't grow up here in California. I grew up in the Southeast mainly. So I appreciate the nicer weather.
I'm glad.
Yeah.
And I like how you said just a doctor.
Just a regular one.
That's awesome.
Just a simple doctor.
Really big achievement there. So can you share with us a little bit about your journey at IHC?
Sure. Yes, I started here as what's called a locum tenens coverage doctor. So the deal was that one of the doctors here, Dr. Rokiki, was on maternity leave, and they needed someone to be here and see her patients and take care of all of her inbox stuff and paperwork and messages and all that stuff. That's how I got started. I was here for about 3 months doing that while she was home with her new baby. And then it was a good fit, and I really wanted to work here anyways. I just hadn't really realized, I didn't really know very much about the clinic prior to coming here, or I would have applied to, right off the bat. So but I started here as the locum, which is just a temporary person, and once it was a good fit, they asked me to stay, and at the time had an opening for an associate medical director, and that's what I did. I was the associate medical director and saw patients pretty much, all day, every day. So for me, seeing patients here is seeing everybody of all ages. I see babies, newborn, I see pregnant moms, I see every age from 0 to 94 right now, and for all sorts of regular chronic conditions or acute problems. And so that's what I did for quite a bit, in addition to doing being the associate medical director, which means that people come and ask you a lot of questions, mostly. It might be staff, it might be like a medical assistant or the clinic manager. You'll work on a clinic problem, a concern, a workflow issue, or it might be another provider who needed help with a patient or something. So I did that, and then eventually became the medical director, and then basically kind of just did the same thing as a medical director, but it was just sort of a reshuffling and affirmation of my commitment to be here. And then I did that until this summer. Our longtime chief medical officer, Dr. Balakrishnan, retired, and I have taken over that position. So here I am today.
Long journey. I love it. And
Yeah.
I'm just happy to hear that, you've stayed with IHC over the years, and, that you've enjoyed working here.
Absolutely. I think that I really like the patients. I like working with them, and very much like being here, which is important. I spend a lot of time here. We all do. Those of us who work here, we are often here more of our waking hours than we're at home. So it's very important that we like where we are. And I think that all of the staff and the other physicians and nurse practitioners, we have a good working relationship, and we, just are really trying to take care of the patient and have a good time and laugh. And I don't know, it was my birthday this week, so that was fun. I got, if you could see my office, it's full of sugar skulls type decorations, which is kind of one of my favorite things. So
That's awesome. Well, happy
yeah,
belated.
well, thank you.
So, can you tell us a little bit about what the chief medical officer does?
Right. So we have three chiefs. The chief medical officer handles basically questions of medical quality, medical procedure, policies and practices, and make sure that we have those standards and standard orders and policies that are set up for the agency. I For example, I work on things when a new policy needs to be made. For example, I work on that as well. For example, when we were in COVID, that was just a lot of change. How are we going to manage that? How are we going to take care of the patients? How are we all not going to get COVID? So that kind of thing. So I work with dental even on questions of infection control, and it just really it could be anything from infection control to our chronic pain management. What are the guidelines for our providers so we can support them and make sure that they're taking the best care of the patient according to like nationwide or national guidelines, best practices, and that kind of thing. So that's the chief medical officer's role. Here, part of that role is to supervise the medical directors who are we have one for each medical clinic, our 4 medical clinics. And so I'm basically starting, still kind of separating myself from that medical director role to just be in the chief position, because it's a lot for any person to take on as a medical director too. So, that's I think something that I think is important to always think of is you want to make sure that you're building a person to take over for you in the future so that the organization doesn't suffer. And I think that's been a lesson that I've learned from um, this recent sort of turn of events, that we need to make sure that we're making sure that our other providers are working to improve leadership skills if that's something they're interested in. Not every provider wants anything to do with that. Sometimes they just want to see patients and do their work and not get any phone calls home or like text messages about how there's this issue, or the plumbing is backed up, there's a flood, or just any old thing can happen. You just never know. So
Yeah, well, it sounds exciting. There is some air of, excitement there.
it always is.
What inspired you to take on this role?
Well, this particular role, I have to admit, I kind of tried not to take the role. Once Dr. Balakrishnan left, I said, this isn't, I want to be the medical director and be more focused on our electronic medical record, because it's a huge part of how we take care of our patients, and making sure that we have a lot of efficiencies with that, and our providers are able to do what they need to do, and the staff can do what they need to do, and our quality improvement organization, that they can get data out to make sure that we're we're all, you can plan to do a lot of great things for patients, but if you don't measure it, then you don't know if you are. So, there's a lot that goes into it, and an electronic medical record helps you keep track of those kinds of things to make sure that you're actually doing what you want to do. So that's, what I was hoping to mostly focus on, but I think I'm just basically now hoping to make that a part of how I am the chief. But we'll still need a lot of other provider support. We need providers and clinicians to have input on how to use this tool. Our fancy tool that basically, for most of us, for gosh, 2/3 or more of this agency, it kind of runs our life, it directs, like, everything we do is through this tool. So
Well, I'm glad that you were inspired to take on this role. Well, one,
yeah,
I'm told, two.
I kind of feel like I was they wore me down eventually with kindness and praise, and so I said, okay.
Yeah, I think sometimes we need that extra, like, somebody else believing in us that we can do this. And
Yeah.
I think you're doing a great job. And I'm so happy that you were able to take aside a little bit of time for me. I know we had a scheduling issue earlier this week, and I'm just like, she's so busy. I'm lucky to get her this week.
It's just such a crazy week with the holidays. We have, a lot of providers who are trying to have some holiday with their family, and I certainly have had my share of doing that in the past. So this year it's my turn to be here, and we're just, trying to make sure everybody's taken care of while a whole bunch of providers are out. So
Awesome. Um, for you, what has been a big challenge in the role that you're having, that in your current role or in the medical field as it is today?
I think, well, especially if it's in the medical field today, I think providers and staff are getting really burnt out. And I think that's true everywhere, not just here. So a lot of my role is to help keep them from getting burnt out, and support them to protect us, and but also make sure that we are taking good care of the patients. We can't protect ourselves at the cost of the patient by any means, but it's a challenge, especially in this area, this geographical area. It's so expensive to live here, that it's hard to keep really good medical assistants or front office or what have you. They could go somewhere else. I'm super appreciative of the people that we have here, because they could go to Kaiser or something. And so I'm really happy that they're here. I feel that the providers are probably are able to afford to, just to come to and stay here at this organization, with like more of a mission in their heart keeping them here. But I think, if it's about trying to make your rent, then there's only so much you can have the mission of a company as your primary goal. Sometimes it is. Sometimes you do say, well, this other place I could work is, I could make more money, but they're awful. They're just mean, and I don't like being there. And we've had people come back, So, you just have to make a good place for people to work, and, keep working on this tool, this electronic medical record that is our friend and our nemesis, and try to make it work for us as best we can.
I love that. The necessary evil.
Yes. Yes, it is.
Well, I'm glad. And then, what are some ways that you are working on, in encountering this burnout and trying to make the burden easier on people?
I think training is really important. I feel like, people feel like they know how to do something. And if, that there's a plan, and there's organization, then that is helpful. I think making sure people feel like they, can be heard. I feel that's a really important part of this organization, is that the lines of communication are really open. So, I mean, mainly for our providers, I'm just trying to make sure we get staffed up, and we have all the providers we're supposed to have, because without that, you're just definitely burning people out. If you don't have everyone you need, um, then somebody's got to do that work. So somebody is doing too much work.
Mm-hmm.
Yeah.
So I hear that with, like being fully staffed and then increasing the amount of training that everybody has to ensure that they know how to deal with something and not have to guess and figure that out.
Yeah. I like to, sometimes you can think that it's easier just to do something yourself, but the more you teach somebody how to do it, then they are empowered, and I think that's really important, and that's what training is all about. Training, especially trying to deal with a complex system, you really need to learn how to make it work for you, and that isn't always, right there, and apparent. You need someone to give you all the tips.
I'm glad. What is a common myth that you hear people ask you about as being a physician, in your experience?
I mean, and maybe this is old fashioned, but I think that people expect that, the doctor can do anything and is the one who takes care of everything. And it's a teamwork. It's a team sport. Um, and, and I think that's been something that I've learned over time, is how to ask, for people for their ideas. Sometimes you ask the patient, what do you think is going on? And, even if it doesn't make a lot of medical sense necessarily sometimes, at least you know what someone's worried about, and you can help them know that kind of thing. Like, nope, I don't think that's going on at all. But there's like a famous philosopher who's escapes me. It's probably like Socrates or Hippocrates, I think it is. But if you want to know what's wrong with the patient, you ask them. No, it's a different one. There's like some, famous old man who said that.
No, we can fact check.
The patient will tell you what's going on if you just really talk with them, but it's not just like all in here. They do jam a lot of stuff in our heads. And I'm grateful for that. But I think it's it's just making sure that you are asking for help, and listening to it when you ask.
I'm glad. So often we hear those tales of woe of patients who go see their physician and then they try to present a problem or an issue that they've had, and the doctor will tell them, well, stop moving that way, or it's nothing, or you're fine.
Yeah, it's I wish I had all the time in the world to talk to everybody about all of their concerns, but other people, my patients, are busy people too. Mm-hmm. So I try to figure out, what is it that they're worried about, and what's going to make our appointment a successful appointment for them. And I want to know, what is that going to be for me? Mm-hmm. When I see all this, we could just work all day long on something, or diet, or what have you, but what is one thing we could talk about, a choice or a change or medication or something that we would do, and then we would both feel like we had accomplished something, we're going to go do that and come back and see where we are.
Yeah, I like and appreciate that approach. And I hope that, if there's any physicians listening, that they take a lesson from you about that. What do you feel has been the most important lesson that you've learned over your career?
Gosh, there's probably a lot of them. One that comes to mind right now is like listen to yourself too. If like you have like a funny feeling or something seems, you're like, it's just bugging me. That it's best to follow that intuition and do something about it. So if you're worried that maybe this chest pain is something, and you're like, it just couldn't possibly be, but I'm worried about it. But so I gotta do something about that. You just, if you've thought of it, you should do something about it. I think that's what I became my mantra. Like if you thought about it, then you should check it out, even if it isn't that.
Yeah, like so often you hear stories about people. There's a person, I can't recall their name right now, but they were anxious all the time, and they're just like, what's going on with me? And finally they're like, I'm just gonna go to the doctor to see like what's happening, because I feel like they always felt like their heartbeat was going very fast.
Right.
And they ended up going to the doctor for anxiety, but they did like a blood work scan and other things. Basically they found out that that person had something wrong with their AV valve, their atrial ventricular valve, and that it caused like an irregularity in their heartbeat. But after they got that taken care of, they didn't feel anxious anymore.
Yeah, their heart felt weird, and
Yeah.
which is something that we associate with feeling anxious. Like I think of that, like there's things like there's all kinds of things, that emotions cause physical symptoms cause us emotions.
So I thought that was really nice of you to say. If you feel like if something's in the back of your mind, it's there for a reason. So, listen to that little voice.
Well, and I think it's good to tell your doctor too, like I am really worried about this cough or something that I have because I know that I have a thyroid nodule. And I could say, well, I don't think that's what it is. I don't think that is something we need to worry about, because we've looked at your thyroid nodule and it's not in a place that's going to cause you a cough. Which is not to say we don't need to figure out what's going on with this cough, but I don't think that's it. So they don't have to worry about that. They can know that I heard it. I'm giving them my expert opinion, and we're gonna go figure it out. So tell your doctor what you're worried about.
Of course. Especially patients, we got to advocate for ourselves. In your opinion, what is the most important strength that a person would need to work in the medical industry and be successful?
It's good to be, I don't know, there's so many. You got to be flexible. You got to be creative. Because you don't always have what you need, so you got to figure out how to work around it. You have to be adaptable. You have to be persistent, and feel like work like a detective sometimes to really follow things up, and that's from a physician to someone who is a medical assistant, or calling a pharmacy about a prescription. If there's a problem, then you kind of have to follow through with the whole thing, or else you're just going to waste the patient's time and your time if you don't make sure the patient understood what they needed to understand, and the pharmacy understands, or has clear instruction, and the physician knows what they're doing or what they didn't do. I've certainly sent prescriptions with crazy instructions, and I don't mind getting a message back saying, I don't understand your crazy instruction. And I realize, that our lovely medical system has allowed me to put 2 sets of instructions together. So take 4 times a day, twice a week. And, that doesn't make sense. So, of course, I have to fix that. And that's why we have pharmacists. And that's why we communicate with each other to make sure that these goofy things, don't get perpetuated. So, there's a lot of things, but I think follow through, be creative.
Yeah, and that's a theme that I'm hearing with you is like the follow through, if you feel like something's off, investigate it, figure it out. Like don't just let it be a thought in your head. So I appreciate that. And I hope that my physician also has that same, mantra in her mind. Hopefully. We've been together 9 years, so
it sounds like that they're a good one.
Yeah, I'm a shout out to Dr. Jasing.
Yeah, cool.
And what's funny is my current physician was also started as an intern or a resident with Indian Health Center.
Really?
Mm-hmm.
Over at the O'Connor Family Medicine practice?
Mm-hmm. Mm-hmm.
Wonderful.
Yeah.
And what's their name?
Her name is Dr. Jasing.
I don't know. I don't think I don't know her. It probably was a while ago then, maybe.
Yeah.
If you've known them for 9 years, it might be before, might be a while back. So
yeah, so
I know a lot of the folks in the past 6 years, but that's probably as far back as it goes.
Yeah, and I was just, it's such a small world. And she's like, well, where do you work? And I told her, and she's like, oh my goodness, I used to work there too. And I was like, that is amazing.
Yeah.
Small world.
We're lucky now to have several folks who were residents over there at the O'Connor Family Medicine practice or Stanford Family Medicine practice, our residency. And they work with us. They have Dr. Pollack, Dr. Boyd, Dr. Gomez. So just a whole great group of really wonderfully well-trained family physicians. So we're super happy to have them and hope to get some more.
Yeah, fingers crossed.
Yeah.
What is one piece of advice or some advice, since we can't stick to one apparently?
Yeah, I'm not good. No.
That you would give to someone starting out as a physician?
I would say make sure that you know why you're choosing to do it. I didn't decide to do this until I was like in my late 30s, I want to say. I started medical school when I was 40. So I knew what I knew that I wanted to do this. It wasn't like, my dad's a doctor and there's a lot of expectation or something. You just need to know, why, why it is that you want to do it. I think that's important. And I think the rest of it will probably fall into place for you. But there's so many ways to be in the medical a medical doctor. There's from you could see patients or you could never see a patient. You could be a pathologist and sit in the lab all day, and that's great. So,
necessary, of course.
Yeah.
Well, I like that. Know your why. That's exactly an answer I get a lot from
folks. Because it's hard. It's hard. So you need to know why you're doing this, or you're definitely going to get burnt out.
Well, I'm glad, and I'm pretty sure your why is a really good one since you've been here with us for a while, and now the new role that you're in. That's amazing.
Yeah, I'm a problem solver. I like to do that, and and that's goes way back, to my first jobs I ever had. That was kind of my role, and I like to do that on all levels, whether it's just an individual patient or as an agency, working with our CEO and COO on what we're going to do and where we're taking the agency, to solve the problems of our community. So,
do you feel, or who has been your one of the most important professional mentors to you?
So I think Dr. Balakrishnan was really great to work with, and I think she still provides me with good good advice, and working with as well with Sonia and Ira, the rest of our C-suite. They've been chiefs for a long time, and it's good, for me to get their advice, and because it's just a way being a chief, and this kind of leadership role is, you need to get advice. You should seek out advice, and talk to people about your decisions. And I think that's it's great that we have that kind of team.
I'm glad. So again, the theme I'm getting is know your why. Like, what are you doing these things for? And then also when it comes to advice from, being able to do your job as it is now, or being a physician, ask questions, ask the patient what's wrong with them, ask the fellow chiefs how to chief.
Right. Don't try to do it yourself, because you're probably gonna get in trouble. You won't think of everything. That's why we have a group of people. So yeah, sometimes when I realize that whenever I'm feeling like, oh, that's a big thing, we have this big thing we have to deal with, it's potentially stressful, and then I think, oh, wait a minute, I have like 3 other people I can go talk to about this who are equally as involved. So why do I think I have to make sure this, decide this or figure it out by myself? That's dumb. So
I love that. That's wonderful. Get help when you need help, and you're not alone, especially here at Indian Health Center. There's so many people that you can, pull their ear and say, hey, like, can you help me with this? Or, what's your insight on this?
Right.
As Hedda will tell me, because again, my role is new to me as well. He's always, what are your thoughts? And I'm like, I don't know.
I know.
He's always asking for input, and as I am with him as well.
Yeah, I think, that's a fabulous lesson to learn. Tell me what your thoughts are on this, because, then, it's not like, time will, come later on, where you learn that you didn't ask anybody their input, and now you've made maybe not a great decision all by yourself, and it's just you. You didn't ask anyone else's opinion or help, so it doesn't mean that you aren't making the decision, but you need all the information you can get to make that decision if it's yours to make. So
and then for the new year, because this episode will release after the new year,
right.
Since these winter months can be challenging for folks socially and emotionally, what are some things that you do for self-care?
Definitely exercising. I think that is huge, especially if I'm stressed or worried about anything. I think the best thing I can possibly do is to get at least 30 minutes of exercise in, where I can kind of go to that happy place that you go in your head when you feel like, I can't wait until I'm done with this exercise, because now I'm tired. But it just does things that make your brain better, and I think that's really important. Another thing I realized is I had to move my office, and for the past 2 weeks I've been back here in my old office, which is like slap in the middle of the clinic, and I'm surrounded by all the staff and the people that I work with. So when I moved and became the chief, then I moved to another location, which is just down the street, but it's quiet. There's not that many people around, and it's one of those things where you're like, oh, I'm very busy, I don't have time to go over to building A. But then I realized it's really good for my brain to get up chair and stop staring at screens. So that's always a great recommendation. Just go be around people that give you energy and make you happy.
Okay, so exercise, of course, makes sense. And then just be around people, seek that movement when you can get it. even if it's not
Right.
super convenient.
Right. Try not to fall into that false sort of thing where you think I'm just going to keep plugging away at this thing until it's done, when you're probably not very efficient at it anymore. If you got up and got some more oxygen in your brain, then you would probably do the rest of your work quicker and it would be good. So I think those are important things.
Any advice for folks going into 2024? What are some ways that patients can start off the new year right? Are there any types of examinations or physicals that folks should be doing in the new year, or with I don't know what exactly the stats are right now of COVID or RSV?
COVID's kind of not great right now. I think we're fortunate that it doesn't seem to be super nasty version of COVID. But there's definitely a lot of COVID infections. We've been lucky that we don't have a lot of staff out with COVID, so that's nice. There seems to be some other horrible cough running around, so I think it's always good to make sure that you get your immunizations, wear your mask if you're going to be, especially, just in close quarters with other people. I'm not necessarily, saying that you need to wear a mask all day long. I think that's up to you. If you go out to the Safeway, do you need a mask? I don't tend to wear one myself, just because I know I'm not going to be like close to other people. But if I'm going to be, stuck in a car with people, for sure I will. And then, it's always fun in the new year to make those resolutions. So, I always think it's a good time for a new start. We're always, it's always there for us, the new start, the new opportunity to make some good choices for ourselves. Maybe, not think of them as depriving ourselves of anything, but, doing good things for us because we deserve it.
I like that mindset of, taking care of yourself because we do deserve it. And, these bodies are our homes for the rest of our lives. So, we have to take care of them well.
Yeah. When my dad said in his old age that if he knew he would have had this car so long, he would have taken better care of it. So it's always good to make sure you're taking good care of yourself, because you could be here for a while.